All right, so basically you've been searching the web looking for simple ways to increase mobility after having your knee surgery. Well, in this video, I'm going to show you a few things that I have done in my past. I never had knee surgery, but I've had major knee injuries, all right? And I've had clients who have had knee surgeries, and I'm going to show you some of the things that I do with them. Now, keep in mind, what I'm giving you is just exercises, but this is not to take the place of your physical therapist or your doctor. I'm giving you things that I've seen, that I've known, that I've used, and I've seen it work, but it does not mean that it's going to work for you. So use common sense and let's get after it. So what you're going to need to have yourself a stretching strap or a towel or a t-shirt, anything. This I'm using a foam roller, but you can use some firm pillows and do the same exact thing. I'm using a massage table, but you can do this from the floor. If you can get down to the floor, you can use it on the bed, wherever you are, even on the couch, okay? So the first thing that we're going to talk about is stretching out your hamstrings. The stretching strap, to me, is one of my favorites. So basically, I'm putting my foot through the loop, laying down flat, taking that leg, and I'm pulling up. I know you can't see my feet or my foot, but I'm flexing my toe towards the shin. I'm pulling it down, and I want to feel the stretch through all of this back here. And when I'm doing this, I'm just relaxing through my breath. I don't want to have my knees bent like this. I want to have this knee fully extended to really focus on that stretch in that hamstring, okay? The next thing for you to practice using the same strap is now we're going to bend that knee down, and I'm going to gently pull to bend in, keeping the toes flexed. Hold it there for about 12 seconds, and then come back up, straighten back out. Take a deep breath, and then you're going to go again. You're gently pulling. I'm keeping the toes in the same alignment. I'm not turning the foot out or in. I'm keeping it straight. This is really helping me to bend that knee, and I'm doing an extra pull with the strap, okay? So let me go to the other side so you can really see what I'm doing with my hands as well. So I'm up here. When I pull down, I'm coming down, and this hand is pulling that knee in. 12 seconds. Okay, and then you extend right back up. Beautiful. Now, with this strap, I'm going to come across with the opposite hand. So right now I have my left hand with the right leg. And I'm going to scoot my butt out a bit, turning towards, bring my right butt cheek towards the wall. And I'm going to pull the knee in, come down, come back, and extend up. This is just getting a little movement in your spine. And then again, I'm going to come down, pull it in, drop this knee over, come back, and back up, okay? That's just an added movement just to get some extra mobility. A little bit of mobility doesn't hurt nobody, okay? Now, the next thing for you to practice is we're going to do a straight leg lift or a straight leg raise. So you're laying flat, and I'm going to lift that leg up about 14 inches off the surface. I'm going to hold it there for 12 to 15 seconds, and we're going to bring it back down nice and slow. The next thing you're going to do is do the same thing on the other side. It makes sense to just even it up. Even if you haven't had surgery on the other side, just work the same side, okay? You want to do unilateral, one side at a time, and then back down. And again, you're going to feel your core engaged. I personally like to activate more stomach, so I'll lift my head up off the ground or the tabletop, lift my upper shoulders off, and then bring it down. So I'm looking at the toes the whole time, okay? Now, as you bend the knee in from here, what I want you to practice is just lifting the heels up, Dorsi flexion, then coming right back down. Lift up, Dorsi flex, and right back down. You want to flex in as much as you can. Up, pull it in, and back down, and up again, and back down. Now, those movements, they're amazing for just increasing strength in your knee. For me, it's easier. For anybody else who haven't had any knee injuries, it's easier to move from one exercise to the next. But keep in mind to take your time. Now, with this, we're going to work on just removing the space from underneath your knees and the floor, okay? So what I'm going to do is I'm going to lay down, and I'm going to put this right here, just like this. And I'm going to lay down, and I'm going to relax that knee. So notice this space. There's nothing here, okay? So we're allowing that whole entire area to just straighten out. And then what I like about this versus a towel is now I can actually roll up and then come right back down. Okay, opening up the hamstrings and then pull back up again right here. And I could even roll in even more with the foam roller and then roll right back out and just let the legs straighten out. Now, you hold this a little longer than normal because you really want to work on that leg staying extended. That way you're not limping all over the place for a long time. The reason why you want to start doing that is you want to break up any scar tissue. You don't want to develop scar tissue, okay? Now, another piece that you can add, another great exercise that you can add is your abductors and your adductors. Now, this can also go for you if you have a lot of hip issues as well. This works through helping you strengthen up the knees, the quads, the muscles on the outside, the gluteus medius, the gluteus minimus. All of those things will get worked. So you want to lay on the side. You want to get yourself in a comfortable position here. Keep the toes flexed. And you want to lift up about 13 to 15 inches off from the other leg. And you're going to come down slow. And then land, boom, like a helicopter. And then come back up, nice and slow. Bring it up. You don't have to go ridiculously high. We want to keep the pressure through these muscles here. And then come down slow, okay? On the other side, now you can take the bottom leg, and that bottom leg, you can lift the bottom leg up. So you're going up this way, opposite, and then coming down. And you go up again, and then come down. And your foot placement can be here as well. You can cross this leg and lift this one, which is more complicated, and back down. Now, the last thing I'll tell you on this video is leg swings. Okay, I'm just going to let the leg just swing, dangle, like a little kid. You know, a little kid's just sitting at the park and they're just dangling their legs. This is just all I'm doing, and I'm relaxing. I'm not using any effort. I'm just relaxing. All right? So now keep in mind, those movements are not designed to be complex. These are not your complete strength building exercises. There are way more videos that I'm going to share with some of the more intense strength pieces. This is really just getting you prepped to increase that mobility so your knee can get more flexion, more extension to increase the angle of your knee. All right? If you do not, I promise you, if you do not practice moving your body every day and working on that knee, your knee is going to seize up on you. Okay? So don't let nobody tell you anything. You have to be a soldier, and you have to push yourself enough so you can break away from that pain as the months go by. Notice I said months, not weeks, months. It's going to take time to heal up. All right, this is Sensei telling you that your body is just a body until you make it a temple. And don't forget to leave a comment. Don't forget like, share the video, and subscribe to the channel. I'll see you later. Bye-bye.